Yeah.
Can you eat too many calories? I'm always afraid that I won't lose or...
Yeah.
You
Sure.
know, I'm just always, there's always this thing in my mind that,
Have you got an estrogen patch on?
no.
Okay. A lot of people have a lot of worries. So you certainly could worry after my surgery that surgery could fail you. And we have had failures. So on the other hand, will worrying help you? Will that do something better about your recovery? When we see people with worries or cravings, especially those of the female persuasion, we remind ourselves of estrogen. And the reason, for those of you who haven't heard the story, let me tell you about estrogen and obesity. There are a variety of serious medical illnesses that are associated with being overweight. Diabetes, high blood pressure, high cholesterol, gout, osteoarthritis, migraine headaches, shortness of breath, sleep apnea, and the list goes on and on. And in most cases, after the surgery, those major associated medical illnesses get better or go away. One of the most important hormonal abnormalities that goes with being a woman who's obese is abnormally high estrogen. And abnormally elevated estrogen increases a woman's risk of breast cancer and endometrial cancer. Right after the surgery, great news. Estrogen levels in abnormal women who have obese, elevated estrogen levels drop precipitously. So pre-op, obese women, high estrogen, immediately post-op, estrogen drops like a rock. As far as long-term health, that's terrific news because we may be protecting you against the risk of breast cancer and endometrial cancer. This is wonderful news. Just like quitting smoking protects you from lung cancer. And I'm happy if you quit smoking, and that's good for your health, but just like a sudden drop in a woman's estrogen, I don't want to be near you right when it happens. So, if you quit smoking 2 packs of Camels a day, that's good for you. I just don't want to be around you when that happens, because when you drop that nicotine level, you're angry, annoying, everything worries you and bothers you at 10 times that level. If you take a woman with very high estrogen and she loses weight rapidly after the surgery, we have found in 20% of patients you'll have a tremendous emotional response that's no fun for the family. Now, it's good long term, okay? But just like cigarette smokers can use a nicotine patch to help them get through this experience, we found that an estrogen patch can help you with this experience. So if you've gone through major surgery, which you have, right? Which you could die from and have a leak and have infections and all kinds of terrible complications, and you didn't have any of those. If you notice that you've had all those blessings and you've lost, your surgery was when?
Almost 10 weeks.
Okay. And you've lost how much?
Last week it was 36.
Okay. And you lost 36 pounds, you had a safe surgery, you're doing well otherwise, and you find you're worrying, think estrogen. In other words, you've been given a miracle. In your whole life, you've been fighting your weight. Is that correct?
Correct.
Okay, and now it's over. We won. And you're still worrying. You can quit worrying, or you can fix the estrogen.
Yeah.
Okay? Huh? Yeah.
It's a wonderful thing.
Do you mind introducing yourself to the group?
My sister's here getting the surgery, so I've got a bunch of patches.
All right.
The economy size pack.
Okay, now this is, just imagine that we're on the flight deck of a carrier, and I'm talking to the pilots who are going out on a difficult and dangerous mission. Okay? To the pilots. Okay? Eyes on me. Okay? If mama ain't happy, ain't nobody happy. Okay? So everybody, let's get together and remember, if you're in this situation, you know, your wife has been blessed with a spectacular, successful, uncomplicated, miraculous weight loss. And if you're still worrying, think estrogen.
How does postmenopausal affect that?
Well, in theory, postmenopausal women shouldn't see the big drop in estrogen because they should already have a low estrogen. So let me tell you a story. One of my patients was a professional woman from California. And you notice as we look around this morning, most of you are dressed somewhat casually. When she came to clinic, she was in a full suit and high heels and stockings, and makeup was on and hair was done and everything, and you know, ramrod straight, and hello, Dr. Rutledge, and introduced herself, and And post-operatively, she did well, but about 3 or 4 or 5 days post-op, she called me one evening with a million complaints. You know, Las Vegas was too hot, the cabbies were annoying, Trish and Sandy were abrupt and sharp with her, I wasn't that funny. The hospital was dirty, you know, just everything. Plus, when she stood on one leg and pulled her ear, her nose itched. And when she winked her right eye, she could feel it in her left ear. I mean, just terrible things, you know. So I'm listening to all this, and at the end of all this, I couldn't really put anything dangerous to anything she mentioned. So I said, I wonder, just as a possibility, whether you might wish to consider trying an estrogen patch. Well, I thought flames were going to come through the phone. Doctor, boy, I can't imagine. You don't even know who your patients are. I'm postmenopausal. You should know this. This is embarrassing. I come to you with important complaints, and you put it off on my gender. I thought you were better than that. And the horse you rode in on, your family, and you know what? I listened, and the fire died down, and I said, well, let's go over these things again. I don't think I can fix the cabbies. The temperature is out of my control. What can we do? And anyways, I said, you know, for the heck of it, just for me, maybe try the estrogen patch tonight. You're probably right. It won't make any difference. And I listened, talked, and finally hung up. And the next morning was clinic. And she was there in clinic a week post-op, again, completely dressed in suit and everything like that. And she came up and talked to everybody. She said, Dr. Rutledge is wonderful. The hospital's spectacular. This is a miracle. This is great. You all need to have it. And she did not want to have her staples out in front of everyone. So we went, and I took her staples out. And I said, you know, how are you doing? She's spectacular, Dr. Rutledge. Thank you very much. And I said, did you try the estrogen patch? She said, yeah, but it didn't work. So, now if you had breast cancer, you can't have it, but otherwise, if you're grumpy or tearful, if you find the events occurring in your life don't match up with the emotions, think the estrogen patch. And I'll give you just a couple more examples, and I could give you examples all day long. Okay, because I take care of women. And after the surgery, their estrogen goes down, and they're not happy. So, I'll just give you a couple of examples. If you notice the events in your life and the emotions don't match up, think estrogen. So here's an example. A lady and her husband are sitting here in the chair, and we brought up, are you taking the estrogen patch? She said, yes, but I don't need it. And her husband turns to her and says, honey, you were crying at the cat food commercials. Another time we invited a woman up post-op, and she sat here, and I was videotaping her, and she started crying, you know, and she said, you know, I was riding with my husband, and I told him, you know, you have a passenger who's a patient, you should be more careful. And so I asked the whole group, I said, patch, you know, every hand raised. I don't think I did a patch, he's just a bad driver. Okay, now this is funny, right? Then the next lady gets up and goes, my husband's a bad driver. So there's this reticence about taking the estrogen patch, but just think about it. It's a tremendously valuable short-term tool. In our studies, 20% of patients can use it to help. And also remember, there is a tremendous hormonal change going inside of you. This surgery is powerful therapy. You are going to be transformed by this surgery. You're going to be half of your former self. Okay? The hormonal change inside of you is stunning, it's remarkable, it's powerful,